My name is Rachel. I'm a student nurse with OSUIT, and they've asked me to come in and do just a basic physical assessment with you. Is that okay?
Okay.
Okay, I'm going to go ahead and foam in, clean my hands. Okay, I'm going to verify the patient's identity. Can you tell me what your name is?
Heather Hasselmeyer.
All right, and your date of birth.
11/13/1977.
Okay, Mrs. Hassmeyer. What they've asked me to do is a head-to-toe exam. So basically, I'm just going to start at your head and then I'm going to move to your toes. Just going to kind of check everything out. What I want you to do is if anything is uncomfortable or hurts, I want you to tell me, okay?
Okay.
And at this point, I'm checking the patient's affect. I want to make sure that she's oriented and alert and she's responding properly to my questions. Okay, so I'm going to go ahead and I'm going to take a look at your scalp. Make sure I don't see anything out of order. I'm going to palpate the scalp. I'm looking for infestations, any bumps, lumps, lesions, anything that's uncomfortable for her. I'm going to do the same thing with the ears. Checking for any bumps, bruises, nodules, checking for color, and also that they are symmetrical. I'm going to do the same thing with her neck. Okay, just going to feel right around the front, not going to push real hard. Okay, I'm also going to check the lymph nodes while I'm here. So, I don't feel anything here. Okay, everything looks good there. Okay, now, Mrs. Hasselmeyer, what I want to do is I'm going to go ahead and check your eyes. Okay, so the first thing I'm going to do is I'm going to look to see that your eyes are equal and the shape is equal. I don't see anything facially. I don't see any involuntary facial movements. I don't see any sagging or weakness on one side that would indicate a neurological deficit. So that's great. Okay, so what I want to do is I'm going to go ahead and pull down your eyelids just a little. Okay, I'm looking at your conjunctiva, which is pink and moist as it should be, and your sclera is clear, which is also good. Okay, now I want to check to see how your pupils are dilating, okay? So I'm going to look in one eye. Good deal. Look at the other one. Okay, they did definitely dilate. They went from a 3 to a 2, which is perfect for the sliding. Okay, the other thing that I'm going to do is I'm going to check the cardinal gazes. So I want you to follow my pen. Up, down. At that point, she followed all the way around, and I was checking for nystagmus, and I did not see any, which is great. I am going to check for accommodation. So what I'm going to do is I'm going to hold the pen in front of you. When you look at the pen, then I'll tell you to look behind me, then I'll tell you to look at the pen again, okay?
Okay.
Okay, pen, at the wall behind me, back at the pen. Eyes were equal, responsive to light, and they were also accommodating, which they should be, no drift or anything there. Okay, so I am going to palpate her sinuses, frontal, any pain there? Okay, maxillary, no? Okay, I am going to look in the patient's ears, pull slightly up on the lobe and look down the ear canal. My goal is to kind of see the tympanic membrane. Looks no blockages, kind of silvery colored, which is right. I would repeat that on the other side. I am also going to check for any kind of excretions, and I don't see any. I'm going to check the patient's nose. So tip your head back just a little for me. Look down both nostrils, and I'm checking for any kind of edema or congestion. Also that the midline, there's no deviation in the septum. I'm looking for the straight line down her nose. Does seem to be there. I'm going to go ahead and check to see that her mucous membranes are pink and moist, which they were. And now, Mrs. Hasselmeyer, what I'm going to do is I want to see if you can move air through your nostrils. So flare your nares for me. Okay, looks good. I'm going to touch one nostril, I want you to sniff, and then touch the other one, I want you to sniff from that side, okay? Okay, she's moving air through her nasal airways well, okay, which is what we want. I'm going to go ahead and look in her mouth. Okay, open up for me, stick your tongue out. Okay, tongue is pink, moist, cheeks and the soft palate are also pink and moist. Looking at her gums, look good, lips are nice and pink and moist. Her teeth are intact. Mrs. Hasselmeyer, do you have any dentures or partial plate or anything? Okay, so then I would expect to see about 32 teeth and all intact or as well as they should be for her age, which I do. Now this time I want you to stick your tongue out and say ah for me, okay? Okay. So what I'm looking for there is looking down her oral airway. I want to see the uvula respond when she moves her tongue outward, which it did. I'm also looking for her tonsils and her airway patency. And I didn't see any tonsils, Mrs. Hosmeyer. Have you had a tonsillectomy?
Mm-hmm.
Okay, good deal. That makes sense then. Okay, so all of that looks good. Okay, now what I want to do is I'm going to auscultate your carotid arteries. I want to see if I can hear your heart working in your neck, okay? All right, so breathe in and hold for me. Okay. And I go ahead and breathe out and breathe normally. And I asked her to do that so that I wouldn't hear her breath sounds. I would actually just hear the movement of the blood through her carotid, which I did. Did not hear any bruit, which would indicate an occlusion or a narrowing of the artery. And I would repeat that on the other side as well. I am going to palpate her neck. What I'm basically looking for is that the trachea is on the midline. And I'm going to very gently palpate the thyroid area. And I don't feel any kind of bumps or nodules there, and that's great. That's what we want. Mrs. Hosmeyer, go ahead and look all the way to your left as far as you can, and then all the way to your right as far as you can. Looks like the patient has good range of motion. She also does not show any signs of JVD, and so we were checking that while she was looking. At this point, I'm going to go ahead and I'm going to see how deeply you're breathing. I'm going to look for your chest temperature. So I'm going to put my hands just real lightly on your chest. And I want you to breathe in real big and then out. Okay, so I've got bilateral rise and fall of the chest, which means she's moving air and good lung volume. Okay, I am going to listen to her lung sounds. Just breathe normally for me. Sounding good there. I'm going to lift this way. Okay. And again here. Now I'm also inspecting the skin on the anterior thorax for any pulsations, any variance in color, checking skin temperature and moisture, and everything looks good there. The other thing that I'm going to do while I'm on the anterior portion is I'm going to check for the heart sounds in the 5 positions I'm supposed to, which would be, first of all, the aortic, which is about intercostal space 2 on the right, pulmonary, which is intercostal space 2 on the left, tricuspid, which is like 4 to 5 right off the midline of the sternum. It's kind of hard to get to when the patient has a bra on, but okay. And then also the mitral, which is down just a little further, right off the midline. Now I'm going to also auscultate her apical pulse, which is just off the mid-clavicular and about intercostal space 4 or 5. And I'm assessing for strength, rate, and everything seems good there. Now while I'm here, I'm going to go ahead and talk to the patient about doing a self-breast exam. Mrs. Hosmeyer, have you ever done a self-breast exam at home?
No.
Okay, so ladies our age, and men too, but mostly ladies, want to check to make sure that everything is normal and you don't want to develop any nodules in your breast that you don't know about. So doing a self-breast exam is very important. So what I want to do, normally you would do this like in the shower or at home in bed, but since we don't have those options, we're going to go ahead and I'm going to show you here. So take your right arm, go ahead and put it up and over your head. Okay. Now take your other hand, your left hand, and I want you to palpate inside your underarm, your armpit area. Start at the outside, move toward the inside. Now what you're feeling for is any kind of nodules or enlarged lymph nodes or anything like that. And if you felt anything, you would call your healthcare provider. And once you finish that, what you're going to do is you're going to start, you can lower your arm. Actually, put that back up there, I'm sorry. And I want you to start at the outer edge of your breast, and I want you to go in a circular motion all the way in and spiral in towards your nipple, okay? And you're going to move that tissue around and just feel for any bumps or lumps or anything that's out of the ordinary for you, okay? Now when you get to the center, if you were at home, you would check the color and the shape and size of your nipple, and then you would squeeze your nipple and check for any discharge. Now, if you noticed anything that shouldn't be there, discharge, anything was out of the ordinary, you found a lump, you'd want to contact your healthcare provider immediately for an appointment, okay?
Okay.
All right, now that is important for men as well. So if you have a history of breast cancer in your family, or your husband or your children do, from that side, you want to have the guys do it every once in a while too, because men do get breast cancer, just not as often as women. All right, so I'm going to have the patient lean forward now, and I'm going to check her posterior thorax. Run my hands down her spine. I'm checking for curvature, making sure I don't feel anything out of the ordinary. I'm checking skin temperature, color, for any lesions, any bumps, bruises, anything out of the ordinary. Mrs. Hasselmeyer, go ahead and breathe in really deep for me and let it out. Okay, so I saw bilateral rise and fall up the back, which indicates that she's using both lungs equally and well. I am going to I'm going to go ahead and listen while I'm back here to the breath sounds. And just breathe normally for me. Okay, and then I'm going to run my hand just up your side just a little. I'm going to check your lateral sounds as well. Okay, I would do that on the other side. And all of her lung sounds are clear. No rails, no crackling, no wheezing. Everything sounded great. Okay, so the next thing that I'm going to do is I'm going to go ahead and check your abdomen. So I want you to go ahead and lay back. Okay, are you comfortable? Everything okay? Mm-hmm. Okay, so what I'm going to do while she's sitting is I'm going to just kind of take a look at her stomach. Can you put your hands at your sides for me? Thank you. And I don't see any obvious bumps, any asymmetry, anything like that. Mrs. Hasselmeyer, I'm going to go ahead and touch your stomach, okay? I'm just going to run my hands over. She's a little bit larger, and sometimes you might miss something like that, but I don't feel anything, so that's good. Now, the other thing that I'm going to do while I'm here is I'm going to listen to your bowel sounds, your stomach sounds, okay? See how well everything's moving in there. I'm going to follow the path of the bowel. I'm going to start at the lower right, upper right, upper left, lower left, following the path of the colon. Now I heard active bowel sounds in all 4 quadrants, which is what we want, which indicates that she is actually moving food through. Was there any pain at all in your abdomen, anything going on? Okay, so now I'm going to go ahead and palpate her abdomen. I'm going to start in the same spot that I did before. Push in with one hand, move with the other. Same thing up top. I should feel a little bit of the liver there. Same thing over here. Okay, and I don't feel any masses or anything like that going on. Was there any pain or discomfort when I did that? Okay, that's great. Okay, so what I'm going to do now is I'm going to go ahead and check her extremities, and I'm going to keep you laying down for that. It makes it a little easier when I ask you to lift your legs. So I'm going to start up here at the shoulder, and I'm just going to kind of palpate, check to make sure she's got good muscle development, checking the brachial pulse. Okay, I'm going to check for skin turgor, moisture, and temperature. And then I'm also going to check for a radial pulse. I'm going to check capillary refill, less than 3, which is what we want. I'm also looking for clubbing of the nails or the fingertips, which would indicate that there was a heart issue. Okay, I would do that on the other side as well. The other thing I'm going to check while I'm here is I'm going to check for range of motion. Okay, Mrs. Hasselmeyer, I'm just going to move your joints around just a little. Okay, it looks like the patient has full range of motion. I would repeat that on the other side as well. I'm going to do the same process down the leg. I'm going to check the thigh for any contusions, lesions, checking for temperature and perfusion, any kind of bumps, nodules. Don't feel any. I'm going to proceed down the calf. I feel good by it, or good muscle development. I'm going to pick up your foot here. I'm going to take your shoe off, Mrs. Hasselmeyer. What I'm going to do is just check for any edema in the leg. I'm also going to check for capillary refill. And then I'm going to check for pulse at dorsalis pedis and posterior tibialis, which were both very strong. Okay, Mrs. Hasselmeyer, what I want to do is I want you to put my hand down here. I want you to push against my hand. Okay, good. Now pull against my hand. Perfect. Okay, now what I'm going to do is I want you to bend your knee towards your belly. Okay, rotate your leg outward. Rotate back inward. Perfect. Okay, I'm going to set your foot right back down on top of your shoe. Okay, so I would also do that to the other leg. What I'm checking for is range of motion, that she has good perfusion in her feet and her legs, and she has bilateral muscle development that shows that there's no weakness on one side or the other. And that is pretty much what I would check. I'm going to help the patient sit up. All right. Mrs. Hasselmeyer, is there anything else I can get for you today?
I think so.
Okay, temperature in the room is good. Can I get you any water or anything?
I'm good, thank you.
Okay, well, I will be back probably in a couple of hours. In the meantime, if you need anything, your call light, your button is right there at your head. I'm going to go ahead and lower your bed all the way down close to the ground, and I'm going to lock these rails up, okay? Okay? I will see you just in a bit. Thank you.
Thank you.
Foam out.